Before we begin, this video is general health education, not personal medical advice. Your hair grows in 3 phases: anagen, growth; catagen, transition; and telogen, rest. Anagen lasts months to years depending on genetics and health. While cells divide rapidly, catagen slows growth, shrinking the follicle. Telogen sheds about 50-100 hairs daily normal per MedlinePlus. Age, hormones, or stress can shorten anagen, thinning hair over time. Your hair color comes from melanin, tiny pigments made in your follicles. Eumelanin gives brown or black shades, while pheomelanin creates red or yellow tones. As you age, pigment production slows, leading to graying. Sun exposure can speed this up by damaging follicles. While stress or diet may affect overall health, research on their link to premature graying is ongoing, and inconclusive genetics and time are the main factors. Hair loss is normal, about 50 to 100 hairs a day, but clumps or sudden thinning may signal biological factors like genetics, hormones, e.g. male-female pattern baldness, illness, or stress. Conditions like alopecia areata cause patchy loss, while thyroid disorders can disrupt hair growth. Sun exposure isn't linked to thinning. It's mostly about time and genes. Track patterns, like when shedding spikes, and discuss them with a doctor using notes on family history or symptoms. Hair changes like growth speed or color shifts are mostly influenced by biology, not just lifestyle. While protein supports hair health, hair vitamins lack strong evidence. Stress may cause temporary shedding, but doesn't directly cause conditions like pattern baldness, which stem from genetics and hormones. Track patterns, like increased shedding, in a notebook or journal to discuss with your doctor, using tools like symptom diaries or family history notes. Stress can sometimes cause temporary hair shedding, like after a major illness or surgery. This is called telogen effluvium. It's not permanent, but can feel alarming. However, stress alone rarely causes long-term thinning like male or female pattern baldness, which are mostly genetic. If you notice extra shedding, track it in a symptom diary, like noting when it starts and how much hair you lose daily, and share your family history with your doctor. This helps distinguish normal changes from conditions that may need attention. If your hair thins suddenly, like losing clumps after illness, or if you notice scalp itchiness, redness, or patches, those are red flags worth discussing with a doctor. It's not about guessing. It's about tracking symptoms, like when shedding spikes, and sharing them clearly during visits. Bring notes on medicines, supplements, or family history of hair loss to help your provider spot patterns. This isn't about stress causing long-term baldness. Those are genetic, but about ruling out other causes that might need attention. You've probably heard that certain shampoos or diets can speed up hair growth, but science says these claims are more myth than fact. Hair growth is mostly controlled by genetics and hormones, not the products you use or what you eat. That said, a balanced diet supports overall health, which can help your hair look its best. Over-the-counter serums? They're not proven to change growth speed long-term. If you're curious about your hair's changes, track them in a symptom diary and discuss with your doctor during visits, just like tracking medicines or supplements. Your hair isn't static. It changes as your hormones shift, especially during puberty or menopause. Androgens like testosterone can speed up growth, but may also cause thinning, while estrogen helps keep hair thick. These are normal changes, not red flags. If you notice sudden shedding spikes, track them in a symptom diary and share with your doctor to rule out other causes. This isn't just about genetics. It's about understanding how hormones influence your hair over time. Your hair isn't just shaped by genetics. It also reacts to your environment. UV rays can weaken the protein structure of your strands, making them more prone to breakage. Heat from styling tools like blow dryers or straighteners can further damage the outer layer, leading to split ends or frizz. Pollution particles may settle on your hair, weighing it down and causing dullness. These changes are temporary and don't signal long-term health risks, but they're worth noting if you want to keep your hair looking its best. Hair loss can feel overwhelming, especially when it affects how you see yourself or your confidence. If you notice sudden changes like patches of thinning, increased shedding, or hair that feels brittle, it's important to talk to a trusted healthcare provider. They'll ask about your symptoms, like when they started and what makes them worse. This helps rule out other causes while supporting your mental well-being. You can also track patterns in a symptom diary to share during the visit. Remember, this isn't just about hair. It's about feeling comfortable in your own skin. Some supplements claim to boost hair health, but science hasn't fully studied them. We don't know if they're safe or work long-term, so it's risky to try without checking first. A doctor can help you weigh the risks, especially with your health history. That way, you avoid guesswork and make choices based on real evidence, not promises. Hair changes, like growth speed, color shifts, or thinning, are normal and often linked to aging, genetics, or lifestyle. If you notice sudden patches of loss, increased shedding, or brittle hair, it's important to talk to a healthcare provider. They'll help rule out other causes by asking about your symptoms, like when they started or what makes them worse. You can prepare by making lists of any medicines, herbs, vitamins, or supplements you take, and noting questions or concerns. This way, you make the most of your visit, whether in person or through telehealth. Remember, this isn't just about hair. It's about feeling comfortable in your own skin. Remember, this is general health education, not personal medical advice. For individual guidance,